And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Those kids may think napping is bad. Once they get older, they will love naps.
I hated it when I was growing up.
Oh, I loved it.
Yeah, when I was that age, I couldn't wonder why they put us to sleep. I felt so good. Why am I having to go to sleep? But you're right. As we get older, we need more rest, and we look forward to those napping. And it is beneficial. I typically feel very refreshed when I wake up.
Can you talk to our boss here about those midday naps?
I will try, but something tells me he's not going to like that. So it's got to get the work done.
Okay, but naps are beneficial for kids and adults alike?
Absolutely. Only if we could put that in the work day, that would be a good thing. But, you know, we got to get the work done, and that would be very disruptive in a lot of cases. So, you know, patients want to be seen. I couldn't take a nap for 2 hours.
But 2 hours would be a good thing if we could get.
Yeah.
I'm just trying to negotiate.
Absolutely,
with you.
yes. 2 hours would be good.
Okay,
so
a
you normally feel very
work day and a 2 hour nap. I like where we're going with this.
Yeah, absolutely.
Okay, on to some of our viewers' medical questions. This person wants to know: have you heard about teens smoking alcohol, using dry ice, alcohol, and then inhaling it?
I haven't heard it. I mean, there's a lot of drugs out there, a lot of access to all these sorts of things. It just surprises me every day how Americans are just trying to figure out how to abuse themselves. So I haven't heard of this. Hopefully it's totally false, it's untrue, because there's just enough drugs out there already and enough abuse out there, so hopefully not.
Okay, another question. Is there anything sold over the counter that can help with anxiety and panic attacks?
Not necessarily, but Benadryl has been used by a lot of folks to help them go to sleep, so it may have some sedative effects. Benadryl is a little dirty. It has some side effects you have to deal with, so you have to be aware of that. And if you have other medical problems, sometimes patients use herbs and nutraceuticals. Dietary supplements sometimes help them out as well.
Okay, another question. I have problems breathing sometimes. It happens when I get upset or just sitting there. I have chest pains and my left arm goes numb sometimes. What could it be? It scares me when it happens.
It might sound like some anxiety, but certainly could be something physical or organic. So certainly they need an evaluation of their heart and their lungs, some blood work to make sure nothing else is going on, and maybe try some anti-anxiety medications such as citalopram or maybe even Xanax.
Okay. My 9-year-old has recently developed heartburn. He complains of being nauseous. Is this related to heartburn? And if so, what can I give him?
The thing is, nausea is very nonspecific, can be from a lot of different illnesses. So before we assume, I probably recommend they get a good thorough evaluation, a good history and physical, some lab work. If there are medications, maybe stop those. But if all else is normal, yes, maybe they can try an over-the-counter Pepcid, maybe in conjunction with talking with the pediatrician.
Okay. How can one get rid of a boil infection, and is blood in the stool bad? Two questions.
Yeah,
there.
boil infection normally is from staph, MRSA. We see it all the time. Antibiotics normally work very well for that. Sometimes it needs a little surgery. And then blood in the stool, certainly if it's continuous and frequent, a lot of times it's from anal hemorrhoids and things that are benign, but certainly we're always concerned about malignant issues. So certainly if it continues, get a colonoscopy, get with your physician.
Okay. My 14-year-old is very active. She says that sometimes her heart feels like it stops and then starts. She says it hurts when it starts back because it thumps twice as hard. What can cause this? And by the way, these are her words on trying to explain what's happening.
Yeah, I think the good thing is just to get a little evaluation. Sometimes we can put what we call a Holter on a patient. It monitors the heart rate, and we can kind of see if there's anything benign or malignant. It sounds benign, and certainly anytime we exercise, our heart rate is expected to go up, but that's something that I would recommend, including some lab, including thyroid and CBC.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says she's a woman with a cough. She's had it for 5 days. She took a steroid shot from the doctor. She's still coughing. What else can she do?
Sometimes she needs some steroids orally that we can write a prescription for. Sometimes some cough medication, an inhaler. Sometimes acid reflux medication. You know, with upper respiratory infection, sometimes the cough can last for several weeks. So just get back with your doctor and try some different medications.
Allergies coming into play at this time?
Allergies are always a concern. Sneezing, watery eyes, itchy throat. Those are some allergy symptoms, and can certainly try over-the-counter medicines. Claritin, Zyrtec, Allegra work really well.
Okay, a man has constant ringing in his left ear. He can't hear out of it. Is it related to sinuses? What else could it be?
Sometimes, but unfortunately, the longer the ringing lasts, the more damage possibly could be done. So get in with your PCP or your ENT for a thorough evaluation quickly, because sometimes steroids can preserve your hearing, because if the hearing goes, a lot of time it's permanent, and you don't want that to happen. So I certainly wouldn't let that go without some treatment.
Okay. Is peppermint oil effective for irritable bowel syndrome, and will it affect the kidneys?
I don't know, to be honest with you. A lot of different things that nutraceuticals over the counter that help with IBS, irritable bowel syndrome, kind of related to stress. Certainly, if it doesn't hurt you, probably it's okay. Just do your own homework and figure that out. Certainly, if you have any side effects, stop the medication.
Okay. A 70-year-old woman had a pap smear and found out that she has HPV. Are there any gynecologists in Southeast Texas that would accept Medicaid?
I'm not quite sure. A lot of times you can call Medicaid and they can kind of give you a list of the physicians that will accept Medicaid. A lot of times at 7 years old, HPV, probably not a high-risk patient. We're normally trying to target the younger folks and get the vaccines going because the risk of cervical cancer is so high. If at the age of 70 she has no cervical cancer, her chances are pretty low. So probably not a rush, but certainly get it checked out by an appropriate physician.
Okay, a woman just had a stroke. Her doctor here has tried to get her into two neurosurgeons in Galveston and Houston. She has no insurance. What should her next step be?
Sometimes it's very difficult. A lot of times the hospitals can work with them to find a physician here or somewhere else. Sometimes physicians do accept cash-paying patients. Sounds like she needs a big surgery, so I would just keep working with the local hospitals to find some alternatives for her.
Okay. If blood pressure is 144/99 and you're taking meds already, should you call the doctor to let him know?
Yeah, absolutely. You know, it's not sky high, but it is above target, and certainly I would probably want to adjust this patient's medication. You know, a lot of people look at this and just not even worry about it, and then several months pass and damage is being done to their arteries. So it is high. Get back with your physician because the medicines are very effective, and we want to control that blood pressure. It's a strong risk factor for cardiovascular disease. We're dying from cardiovascular disease in America, so we want to control all risk factors.
What is your target blood pressure?
Less than 140/90. 120/80 is normal, so we just like that range. Keep it within that range.
And especially if you're on meds, it needs to be lower than 144/99.
Absolutely. The medicines are so good. There's so many out there. There's no reason why you should not be controlled if you have high blood pressure. If you're eating right, exercising, and take your medications, you should be controlled.
Okay. Is it possible to have a kidney infection without having UTI symptoms as well? The pain is unbearable, but it doesn't hurt to urinate.
I think by definition you have to have symptoms with a urinary tract infection. A lot of women have bacteria in their urine and they don't have symptoms and they get labeled as having bladder infection. Unfortunately, that happens a lot in the medical community. I'm not a big fan of that one. So you need to have symptoms: fever, frequent urination, burning of urination, lower abdominal pain, nausea, vomiting, something other than just bacteria in your urine. So you have to have symptoms, in my opinion.
All right, Dr. Levine, as always, we appreciate you taking the time
Yes,
to stop by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com or post those questions every Monday on our KFDM News Facebook page.